Hello and welcome to Progressive Education Society's Modern College of Pharmacy e-lecture in the subject Natural Drug Technology. Myself, Dr. Bhushan Pimple. In this lecture, we will have a look at traditional systems of medicine, Ayush, according as per the syllabus of Savitribai Phule, Pune University. This chapter will specifically focus upon traditional systems of medicines and what is Ayush, the Ministry of Ayush, then basic principles of therapy in various traditional systems of medicine, then various Ayurvedic dosage forms, methods of preparation, and evaluation of the formulations. There are various traditional systems of medicine followed in India and other parts of the globe. Few of them are listed, like say suppose Ayurveda, Yoga, Unani, Siddha, Homeopathy, Naturopathy, Aromatherapy, Tibetan and Chinese systems of medicine. Before going into the details of this chapter, first we will see why should a pharmacist study traditional systems of medicine and their products. We'll just have a look at what are the benefits or what are the advantages these traditional systems of medicine and their products enjoy. First of all, they have no side effects. They are very cheap and easily available. They don't require any prescriptions. They are for a manufacturer. If you look, there are various benefits like the requirement for manufacturing itself is very less. There are no very low or no stringent testings specified by FDA as far as the traditional systems are concerned. FDA does not comes into picture. Then they do not require clinical trials, which is very time consuming and cumbersome process. Also, they enjoy the benefit of branding and advertisements, which the synthetic or allopathic counterparts cannot. Whereas, moreover, they manufacturers get more profit out of traditional products compared to the allopathic products. Now, these are the reasons why there are chances that scope for adulteration, misbranding, or producing the substandard quality of the product increases a lot. So, role of pharmacist here is in product standardization to maintain quality by quality assurance, quality checking, to enter into pharmacovigilance of these products and to help understand their patients regarding the safety like drug interaction, herb and drug interaction, if at all a patient is following two different therapies together or simultaneously. Then to develop novel drug delivery systems out of the traditional products and also to amalgamate these traditional system as well as the modern medicine to come up with a new formulation. Now we'll have a look at what is Ayush. Ayush is an acronym for Ayurveda, Yoga and Naturopathy, Unani, Siddha, Homeopathy, and newly incorporated system of medicine. Actually, it is an older system, but it has been recently incorporated into Ayush, and that is Sova Rigpa. Sova Rigpa is followed mostly in Himalayan region or Tibetan region, Jammu and Kashmir, and Ladakh. Initially, Ayush was incorporated as Directorate of Indian Systems of Medicine and Homeopathy, which was called well known as ISM and H in 1995. Later on, it was renamed to Directorate of Ayush in 2003, and in the recent Modi government, Ayush, a separate ministry was formed, incorporated for Ayush in November 14. The ministry was developed just for the conservation, promotion, and development of traditional systems of medicine. Currently, Sri Sripad Naik is the Minister of State with independent charge of this Ayush ministry. The functions of Ayush ministry is to develop Ayush education. Now, Ayush education means designing the course of Ayurveda, Yoga, Unani, Siddha, and homeopathy, and incorporating latest or newer techniques of analysis into these curriculums. Development of Ayush infrastructure. Now, Ayush infrastructure means setting up Ayush hospitals or hospitals that will specifically treat the patient with Ayurvedic medicine or Unani medicine or homeopathy, whatever it is. Then, development of Ayush drugs. Initially, the Ayush drugs are developed from the traditional textbooks, like say suppose Charak Samhita and so on, and to design acts, rules, and notifications or guidelines for manufacture, sales, and distribution of Ayush drugs. Also, this ministry helps designing the pharmacopoeia and formulary for various products. It also helps in the promotion of research in academics or even at industrial levels through research promotion schemes. Now, these schemes assist the researcher with fundings from lakhs to crores in order to promote the newer ideas. It also helps for international cooperation in order to spread the traditional system knowledge throughout the globe. Now we'll directly start with individual traditional systems, like first in Ayurveda. Ayurveda was established 5000 years ago, and it works on the hypothesis of Pancha Mahabhuta. Pancha Mahabhuta means these are five elements comprising of space, air, energy, liquid, and solids. Now, these are the elements from which a body is made up of. It also follows three pillars of life, which are well known as Tridosha. And these Tridosha are combination of the above five elements in an individual. Now, what are these combinations? Are Vata, Pitta, and Kapha. These are the three categories in which Ayurveda classifies its patients or persons, individuals. So every individual is made up, or his body has predominance of either Vata, that means space and air elements are dominant. Then in Pitta individual or Pitta patient, or the patient with Pitta Prakriti, energy and liquid elements are predominant, whereas in Kapha Prakriti patients or individuals, the liquid and solid elements are dominant. Basically, Ayurveda is focused upon keeping the healthy person healthy. That means prevention is better than cure. This is the motto behind Ayurvedic therapy. And also, it teaches a person with to balance if at all there is an imbalance amongst these elements or humus. According to Ayurveda, our body is made up of Sapta Dhatu. Sapta Dhatu are seven different components. Now, what are these seven components? Is food juices or the juices that we intake, then hemoglobin, muscles, fats, bones, bone marrow, or more specifically, nervous system, and shukra or semen. As far as diagnosis is in Ayurveda is concerned, it follows eightfold examination. That is 8 various methods to diagnose a patient. Like suppose we are well familiar with Nadi Pariksha, or also known as pulse diagnosis, urine examination, nervous system assessment, assessment of the digestive fire or metabolism of the patient, then to check the mucus or mucoid secretions, stool examination, examination of the tongue, whether the tongue has a pale tint or covering, mucosal covering, or whether the taste perceptions are reduced, then examination of the bodily sounds like suppose heart rate or gases, etc. Treatment in Ayurveda aims to check the patient's body constitutional type, that is whether a patient falls under vata category, pitta, or kapha category. Drugs are also prescribed based upon the constitution of the body, that is vata, pitta, kapha, as well as the disease or disturbances the patient or the person is suffering from. Patient's health, his activities, day to day activities, and the time of the day wherein the symptoms are at peak, or the season in which the patient is suffering from disease, are also taken into consideration. As far as all the traditional systems are concerned, they all follow individualized approach. Individualized approach means determining the patient's history, the patient's occupation, day to day activities, diet, everything is taken into consideration, and then only drugs are prescribed, doses are decided, and dosage regimen is also framed according to the patient's detailed report. As far as other allopathic or modern medicine is concerned, we generally use generalized approach. Now, generalized approach means same dose to everybody. We will take a simple example of paracetamol. Paracetamol usually we get it at 400 milligram or 500 milligram tablet, and any adult suffering from fever will be prescribed the same paracetamol tablet. Now, here some individuals can break down paracetamol at a faster rate so they can get rid of the paracetamol immediately out of their body. Whereas in others, the same drug remains in the body for a longer duration. Now, this results into development of adverse reaction. Whereas the most of traditional systems of medicines, they do not follow or they do not have adverse reaction, and the sole reason behind that is individualized approach followed during treatment. Attempts are established to balance the bodily humors. If a patient has high vata prakriti, his bodily humors are tried to balance, to normalize. For almost all the diseases, the treatment is divided into three stages. First stage is cleansing the toxins. It is also called as Shodhan Prakriya, wherein most of the toxins, chemical toxins or emotional or physical, like if a person is depressed, in that case counseling is done, and through that the toxins are neutralized or either eliminated, which are the root cause for most of the diseases. Then next stage is called as shaman. Shaman means reducing the intensity of symptoms of a disease. We'll take an example of diarrhea. In case of diarrhea, the first stage will be to clear out all the toxins either through vomiting or through feces. Second stage will be reducing the frequency of excretion. And the third stage is rasayana, wherein chemicals or drugs are prescribed. This helps to reduce the negative effect of the diseases. Normally, the drugs in Ayurveda are of various origins, like herbal origin or source of animal, from minerals or metals. Generally, the metals used are gold, silver, copper, lead, tin. These metals they act as cofactor for various enzymes in our body to carry out routine metabolic reactions. Deficiency in these metals can cause metabolic disorders. Therefore, metals are also prescribed in Ayurveda. Even elements like arsenic, antimony, sand are also present in the drugs.